Hello, I'm Dr. Joel Rosh, Director of Pediatric Gastroenterology for the Goryeb Children's Hospital in Morristown, New Jersey, and Professor of Pediatrics at the Icahn School of Medicine, Mount Sinai, New York. I'm here in Las Vegas at the Crohn's and Colitis Congress, and we're about midway through the Congress, and it's really been quite exciting. A lot of great developments, a lot of great science being presented. A lot of the talks yesterday focused on what patients want to know most: nutrition. How does nutrition, diet affect the gut microbiome? Can we treat inflammatory bowel disease with nutrition? The kinds of questions we get asked every day in the office. Probably the best model for the fact that diet really does affect these diseases is from pediatrics. We know for a long time that we can induce a steroid-free remission in Crohn's disease using an elemental diet. If I take out all food and only give formula, the gut goes into complete mucosal healing. For a long time we thought it was the magic of formula. We've learned it's not. It's taking out of the diet whatever is toxic to the bowel. That's the key. It's not like celiac disease. It's not as easy as gluten. It's probably multifactorial, and the effects on the gut microbiome and the host. And that's what was explored yesterday. Today we really zoomed in on the microbiome. A lot of the research today looks at the populations of the bacteria, and we know that the population lacks diversity and is very different in the inflamed bowel than in the normal bowel. Really where the research is moving, though, is what are those populations doing? And we're looking at the metabolome. We're looking to see what's produced by the bacteria that exist in the inflamed bowel, and perhaps that could even turn into therapeutic targets, either by affecting the bacteria themselves or giving back products that will block the toxic products from the bacteria. Very exciting kind of research, looking at the microbiome, looking at diet, and then tying it all together with the brain. A lot of data was presented today on how stress, anxiety, and the brain itself functions to affect the immune system in the gut and the microbiome. So from top to bottom, brain to gut, we're learning how to better care for our patients. We're hoping to incorporate that all this afternoon in a session that I'll be moderating with Dr. Lori Kiefer, who's a psychologist with keen interest in the gut-brain connection. And we're going to be looking at emerging models of care. How do we take care of the whole patient? Let's take the science to the office, and let's look at psychosocial wellness, health maintenance, as well as keeping the bowel in true total remission. And we have a lot of speakers who are going to be looking at big data, apps, better phone management of your patient. How do we take care of our patients, not just when they're in the office, but in the rest of their lives? So the message today from the Crohn's and Colitis Foundation and from the Congress here in Las Vegas is, let's think about our whole patients and use the modern technology that we have today that's just in our pockets, our smartphones, what's available to all of us, to provide better care as we move the science forward.